Chronic wound infection can be incredibly difficult to manage. In part, this is because bacteria can grow within the wound as a biofilm. Biofilms are communities or collections of bacteria that live together, and they can grow in many different environments, including waterways, the soil, and also in chronic wounds. They will produce, as they grow, a sticky coating that acts like a shield that protects them from environmental stress, including antibiotic treatment or antimicrobial treatment. And it's understood that biofilms can be present in over 80% of chronic wound infections. Biofilms form when bacteria from the environment, maybe of host origin from the skin or gastrointestinal tract, attach to the chronic wound. And once the bacteria attach, they will begin to grow within the wound and they will cause a localized infection. As the biofilm matures, the community becomes more complex and more stable, and it produces a thick, sticky layer that encases all of the bacteria that are growing there and protect it from immune clearance and protect it from the effect of antimicrobial treatments. Topical antimicrobial treatments can be applied to the surface of the wound, so these might be an antimicrobial cream or a balm or a wound dressing that has an antimicrobial ingredient. These are applied to the surface of the wound where the biofilm grows. The thick sticky layer surrounding the biofilm makes it very difficult for the antimicrobial ingredients in the creams or in the dressings to reach the biofilm that are beneath this protective shield. But if the antimicrobial ingredient can't reach those bacteria within the biofilm, then it can't kill them. So this means that when the treatment is removed or when the treatment is finished, not all of the bacteria in the chronic wound have been killed. Some remain behind, where they will continue to cause an infection, or they will allow the infection to recur, which means that chronic wounds can last for many months or many years. Clinical teams help to manage chronic wound infection, and they may take a number of different approaches. Treatments might involve the use of several different types of topical antimicrobial, be these creams, balms, or dressings. They might have different antimicrobial ingredients and be used for different lengths of time. Topical antimicrobials should be replaced or replenished regularly to make sure that there's sufficient antimicrobial ingredient to continue to have a positive effect against the bacteria that are causing the chronic wound infection.